Hi, thanks for joining me today. My name is Scott Kamshafer, and I'm a clinical social worker, and I currently practice in Austin, Texas. And today I wanted to talk to you about the 5 do's and don'ts of dealing with somatic symptoms. And somatic symptoms are something that you experience that you feel a pain or a strange sensation somewhere in your body, but that sensation or pain has no physical cause. And people with somatic symptoms tend to go to doctors and they get tested and they get evaluated, and there's no physical cause that's identified as being at the root of their physical complaint. And this causes tremendous suffering for people because they're being told that don't worry about it, it's all in your head. That's one of the key phrases that is used to refer to people who deal with somatic symptoms. And unfortunately, that's not reassuring, because what it does is it reinforces this idea that there's something wrong with me, but I don't know what it is, and they can go around in circles, and just be so worked up in a frenzy as to trying to find out what it is that's causing this somatic complaint that they've had for so long, but have no idea exactly where it could be rooted. So that is, again, a source of tremendous grief and angst for people because they just can't figure it out. And the Cleveland Clinic says that between 5 and 7% of the population have a somatic symptom disorder. And yet, if these somatic symptoms are related to anxiety or trauma or underlying depression, then it may get masked because it's part of a larger disorder. And that's usually what I find with my clients. So what I'd like to offer you are some do's and don'ts, 5 in all, for dealing with somatic symptoms if you're somebody who's been told that's what you're dealing with, or somebody has told you it's all in your head. The first one of those is to not seek reassurance. You've already been told an indefinite number of times that there's nothing that the doctors can find that's wrong with you, that you have nothing to worry about. So seeking more reassurance, unfortunately, can make things worse rather than make them better. So don't try to get more "don't worry about it" comments from other people. One thing that is important to do is to seek therapy help, because chances are you are dealing with an underlying disorder, either in terms of anxiety or PTSD or trauma or depression, that could be related to the somatic symptoms. And once the underlying disorder is treated, especially with some forms of trauma therapy like the ones that I use, to being EMDR, which is short for eye movement desensitization and reprocessing, and 2, image transformation therapy, that either treat the somatic symptom itself or the underlying disorder, if that's in fact what's going on, that those will generally resolve themselves. And it's really quite wonderful to work with clients and have these things that have bothered them, these somatic symptoms that have bothered them for quite some time, just go away. And with a little bit of therapy help, that can possibly be the case for you. And then the idea is also to not dwell on your somatic symptoms. The more you focus on them, the more that will make them worse. So doing things to distract yourself from them, like the next do is to practice relaxation exercises, like deep breathing or progressive muscle relaxation or whatever. Because the more you're able to relax, the more you're going to alleviate the root cause of your somatic symptom, and particularly if it's anxiety or trauma related. And the other don't of the 5 do's and don'ts is to don't isolate. Go out and do things. Don't just stay in and act like the world is coming to an end, because the more you're able to get out and focus on other things and other people, maybe doing people watching, that will actually take more of the focus off of you, as well as not dwelling on the somatic symptoms that you're having. So basically the idea is to focus on relaxation skills, look outside of you, not within. Don't seek reassurance when you do go outside of yourself. And if you live in the Central Texas, Austin area, and you need help with this kind of thing, and you've already been told by dozens of doctors or maybe even a half a dozen, that they don't find anything that's wrong with you, give me a call or someone else who practices one of these trauma therapies like EMDR, image transformation therapy, and get some help for yourself so you don't have to suffer indefinitely into the future like you've been suffering going way back into the past with something that need not bother you. And once you get at the root cause of it, whatever it is that's causing it, it could be something major, maybe not, but that will usually resolve the somatic symptom, and you've dealt with two problems in one. So I thank you so much for watching today. I wish you the best of mental health and health overall, and I hope to see you again in a future video. Thank you.